Hi everyone, this is my presentation on my vulnerable population, which is individuals who misuse, abuse, or are addicted to illicit narcotics or opiates. So for my health concern summary, this population is at risk for communicable and non-communicable diseases, self-care deficits or self-harm, being harmed by others, or harming others. They are also at risk for low economic stability, low socioeconomic status, multiple health disparities due to genetic factors, stress, other environmental factors. So for media does play a big role in this population because I feel like most of the time when you're watching a TV show or a movie or the news nowadays, there's something related to opiates or drug use on there. So I think that most news things portray it pretty accurate, but for TV shows, there are a lot of shows that just involve like the partying and maybe like how drug laundering or drug dealing can involve a lot of money, and this can make using drugs seem more appealing. But other shows and media platforms that are more accurate definitely show the real side of addiction and how hard it is to overcome and all the losses related to it. So for cultural environment and family support, families are significantly impacted by addictions, and family involvement in treatment can reduce harm and improve treatment outcomes for the individual. So I actually found that really interesting. I Googled a couple articles and they all pretty much said the same thing, that families that are more involved, the individual has a way better chance of staying sober and preventing a relapse than families that do not have as much support. So that was interesting to learn. For role of peers, they can kind of play all roles. So they can be destructive, they can be enabling, and they can also be supportive. I think that there's a lot of situations where peers are very destructive, and there's definitely some peer pressure involved with doing drugs. But in one study done primarily on males, the most common determinant of opiate use was peer influence. But peers can also play a critical role in motivating individuals to enter and stay in treatment. So, and then also I feel like a lot of these people that go to these treatment facilities end up becoming very close with their peers in there, and then they kind of encourage each other to make the right choices and to stay clean, and they support each other throughout. So, cyclical nature. Children living with parents who have a substance use disorder are at an increased risk for engaging in substance use themselves and potentially developing an addiction. And then genetic research has provided evidence that opiate addiction is not only environmental, but there is a heritable factor to it as well. Okay, so for the legal and political system, so drug-related arrests, convictions, and incarcerations continue to increase each year, and the correctional institutions, specifically in the United States, are continuously looking for best practices that they can use to handle the growing demand for the substance abuse and treatment. Individuals leaving incarceration with opiate addictions face a high risk of relapse, and I should have put it in here, but I actually was able to find an article that specifically talks about that, and it talks about like how important it really is to make sure that when they leave, they do have adequate treatment to make sure that they're not just going to go relapse, because the relapse rate is really high as soon as they get out of jail or prison. So, and then the Bureau of Justice's Assistance Comprehensive Opiate Abuse Program is an online clearinghouse that talks about training, information, and other resources that are available that multiple state and local areas have access to. So that's something that can be helpful. So for potential barriers, I found this interesting. Over 60% of Utah's residents are members of the Mormon Church, and they are LDS, and they forbid the use of drugs. Within the last couple years, they've become more open to this issue and have started more programs to kind of help support their members of the church that are struggling with this. But Utah has one of the highest rates of prescription drug addiction in the country, with an average of 21 residents dying from pain medication abuse each month. Members of the LDS Church struggling with illicit and narcotic opiate abuse, misuse, or addiction may feel too ashamed to open up with their problem, or maybe feel like they won't be welcome in church. So I feel like this is something that could definitely make them keep this to themselves and prevent them from telling people and kind of keeping, them lying, and so preventing them from getting the help that they need. So international scope, I found some information on the Philippines. So they pretty much have like a no tolerance at all law enforcement against drugs. So they just main focus is on implementing policy of criminalization, punishment, which leads to many arrests and many killings just right off the bat. So this escalated many human rights violations, and it peaked in 2016 when their Philippine resident launched a campaign against illegal drugs that was worse than most people thought it would be. So he ended up just kind of like shooting people on the site if he even had a tiny suspicion that they were doing anything drug related, and it led to a lot of unnecessary killings and just uncalled for situations. So that could definitely be a dangerous area for that population to be in. So socioeconomic status can definitely contribute to opiate and narcotic abuse. If an individual has a low socioeconomic status, they might not have appropriate access to healthcare or the treatment that they need to overcome their issue. They might not be able to get adequate food, clothing, or shelter, and this can cause other complications and health disparities. So for race and ethnicity, in one study done between 1999 and 2018, prescription opiate misuse was significantly higher among non-Hispanic white individuals. However, the highest amount of misuse was among Native American individuals. And then early in the study, so towards closer to 1999, heroin use was highest among Black individuals, but it almost doubled its presence in white individuals by the end of the study. So opiate prevention and treatment initiatives should be encouraged in all populations because it's prevalent everywhere. So for religion, many religions disapprove drug misuse or abuse, but their spirituality programs are supportive in their members in the long run. So they have something that they will do to help support their members. But I found it interesting that 73% of addiction treatment programs in the United States include some type of spirituality elements within their 12-step program. And then religion and religion participation helps address the many issues that lead people to addiction and actually contributes to the prevention and recovery from substance abuse. So I thought that was really cool. So for gender, women progress from drug use to drug dependence more quickly than men. Women suffer more severe emotional and physical consequences of drug use as compared to men. Women present with a broader range of issues, so they'll come in with other psychiatric problems or medical problems. They'll come in with more severe employment and social issues. And then another thing is women are more likely to be using other prescription medications along with narcotics and opiates, including barbiturates and sedatives, which leads to another problem in itself because they're all the CNS depressant medication. So they need to be adequately taught that those are not medications they should be taking together. So for geographical location, it can affect health outcomes for individuals who misuse, abuse, or are addicted to illicit narcotics or opiates, because certain areas definitely have a higher prevalence of this population, which makes it an increased risk. But in areas where access isn't as likely or available for rural areas, telehealth and telemedicine could significantly help this barrier by allowing easier access to this important treatment. So for people who live in kind of small farm towns, or I don't know, close to the mountains where there's not really AA meetings or NA meetings that they can go to very often, telehealth and telemedicine could benefit that. So for bias, implicit bias, I definitely think that racism and gender biases fall into this. So maybe doctors thinking like, oh, my patient is white and young and she's female. I don't know. I feel like it's very unlikely for her to have a problem with substance abuse, and I don't really think that she is misusing her opiates, and I'm sure she's okay to have more. But honestly, that's actually one of the highest categories of individuals to misuse them. So that could be one. And for explicit biases, I think that this population is often seen as criminals, poor employees, and lacking a moral compass, when that's usually not the case. So international scope, these health disparities are prominent for the vast population of individuals who misuse, abuse, or are addicted to illicit narcotics and opiates in all regions of the world. Drug use is pretty much everywhere, and these health disparities are very prevalent in this population, kind of no matter where they're located. So this is my reference slide, and that is all. Thank you so much.